What is the right to refuse medical treatment? Imagine being in a hospital bed, feeling overwhelmed, but still having the power to say no to a treatment you don't want. That's what the right to refuse medical treatment is all about. It's a core part of medical ethics and law that respects a person's freedom to make decisions about their own health care. This right applies to adults who are capable of understanding what's happening and making informed choices. When someone has decision-making capacity, they can understand the risks and benefits of treatments, appreciate what could happen if they accept or refuse care, reason through their options, and communicate their decision clearly. This right is called a negative right because it protects people from being forced into treatments they don't want. Healthcare providers must respect a patient's choice, even if it means declining recommended procedures. However, this right isn't unlimited. If a patient is unconscious or unable to understand their situation, doctors must assess their capacity. If someone lacks decision-making ability, healthcare teams consider other ethical principles like doing good for the patient, avoiding harm, and fairness. Sometimes, advanced directives or legal decision-makers help guide care based on what the patient would want. Legally, the right to refuse treatment is protected by laws that safeguard personal liberty and individual rights. Courts have upheld this right, but it can be limited in cases where public safety is at risk. For example, in situations like contagious disease outbreaks, authorities might requiring treatment or vaccination. Many people prepare ahead by creating documents called advanced directives, where they specify their treatment preferences if they become unable to communicate. In practice, healthcare providers must always get informed consent before starting any treatment. They need to clearly explain what the treatment involves, its risks, and alternatives. If a capable patient refuses, their decision must be respected. This approach emphasizes patient-centered care, giving individuals control over their bodies and health choices. It's about honoring their rights and autonomy, even when their decisions differ from medical advice. So, the right to refuse medical treatment is a vital part of respecting patient autonomy. It ensures that people can make choices about their health care based on their values and beliefs. This right helps balance medical recommendations with personal freedom, making sure that patients are active participants in their own care.